Let's Chat.
Good morning. Thank you so much for spending your next 30 minutes with us. I'm Andy Santoro. Chip and I are so happy you're here with us today. Let's get started with our first interview. Dr. Stephanie Holt with Children's Hospital Erlanger is here to tell us about sudden infant death syndrome, what it is and how you can prevent it. Thank you so much for joining us today, Dr. Holt.
Hi, thank you. As you know, October is Sudden Infant Death Syndrome Awareness Month. You may hear SIDS for short. And what it means, it's when an infant dies suddenly or unexpectedly when there's no real cause after investigation. And what's unique is that it usually occurs during sleep.
Interesting.
According to the Center of Disease Control, about 3,400 infants died in 2020 alone, unexpectedly and suddenly. And the usual cause is from SIDS or another sleep accident, such as an accidental like suffocation or strangulation in the bed.
So 3,400 nationally, that's a high number.
Nationally, it is.
What are we seeing in Tennessee and Hamilton County?
In Tennessee, about 100 infants die per year from SIDS or from a sleep-related death. That means about 100 infants per year die from SIDS. And that's about, it accounts for about 25% of all infant deaths. And so that's not like about 1 in 4 babies die from SIDS.
But it might not just be unexpected. It sounds like there's things that parents can do to prevent this or lower the risk. What are they?
Yes, so while we don't know the exact cause of SIDS, we do know that safe sleep practices can decrease the risk. And there are recommendations that the American Academy of Pediatrics has recommended. And an easy way to remember is you think of the ABCs of safe sleep. So an infant should be alone, on their back, in a crib. And alone means they're in the crib without any toys, stuffed animals, soft things like heavy blankets, none of those bumpers that used to be used to decorate cribs, all that removed from the crib. On their back, the back is the safest way for them to be placed, so not on their stomach or side, because it is shown to decrease SIDS. And then in a crib, so on a flat, crib-safe mattress alone, so not in a bed with a parent, not in a chair with a parent, not in the car seat. I would also like to bring attention to nursing pillows. There's been a increased number of SIDS cases associated babies being left in nursing pillows, which are used for breastfeeding, and they're good for that, but babies shouldn't be used to, babies shouldn't be left to sleep on that, because there has been an increased case of SIDS associated with that.
Is there an age when the risk lowers, like when it just the risk isn't there?
I feel like the most babies around like 6 months is when they're at the highest risk. Does increase with time, but there's still an increased risk up until 12 months.
Right. Now, are there things that Tennessee is doing to promote this and Erlanger doing to promote safe sleep?
Yes, so the Tennessee Department of Health has partnered with hospitals across Tennessee, including Erlanger Baroness and Erlanger East, to promote safe sleep practices while parents or caregivers are in the hospital with their babies. So we're educating parents while the baby's with them so they can take those practices home with them to try to prevent SIDS. Erlanger also has a blog, blog.erlanger.org. It has a couple articles that have recently been updated. One is called How Much Do You Know About Safe Sleep and SIDS? And the other one is Safe Sleep for Your Baby, which provides more information about how to prevent SIDS, such as not smoking around your child, breastfeeding if you can, and trying to keep overheating your child with like extra blankets.
Now, let's say there's viewers watching with babies. With what you do, I'm sure you've seen some sadness and experience with this. What appeal would you make to our viewers to really help them follow these rules with what you've personally seen?
I know having a baby is a lot of stress and it can be tiring, but if you can just remember those ABCs, like leaving a baby, they're gonna be safe. Even if they're in the room with you, as long as they're in their own crib, they can be in the room, but as long as they're in their own safe space in their own crib, it's the safest way to keep your baby alive and not dying from a preventable, yes. The thing about that is preventable.
That's probably what's most sad about this. is maybe you've spoken with parents who lost their baby and to have them realize, well, maybe this could have been prevented.
And one thing, I work in the neonatal ICU, and so I take care of premature babies who are at increased risk of having SIDS. And for a baby to survive months in the hospital, I would really appeal to promote those safe sleep practices to keep their baby alive to make it to their 1-year birthday.
Right. Why would a preemie be more susceptible to SIDS?
Just related to just the immaturity of their brain, the regulation of their sleep and their temperature. It just puts them at increase, and then also just kind of their the way they control like their head and muscle tone. It's just not as developed as a term baby, and so it puts them at risk.
And that's why the risk lowers as they get older. They have more neck strength to turn away.
But for any baby, the safest way is alone on their back in a crib.
Wonderful.
Yes.
Thank you so much for coming on the show today, Dr. Holt. So I have children's at Erlanger.org. Perhaps they can learn more about SIDS on that website?
Yes, the website is blog.erlanger.org, and if they search SIDS or if they search Safe Sleep, they should be able to find the articles that we've updated.
Thank you. Great interview. Thank you so much for coming on the show. That's it with Dr. Stephanie Holt, Children's Hospital at Erlanger, to talk about October being SIDS Awareness Month. There's so much you can learn to prevent that. Thank you again for coming on the show.
Thank you.